Hello, welcome back to the channel. I'm so glad you could join me again today. How are you doing? This is Dr. Adaeze Ifezulike on the Obesity series. And this is the seventh, so this is the seventh video. How are you finding it? Have you had any benefit from all we've shared? Please type in the chat, let me know how it has helped you. I'll be glad to hear from you. Today we'll be talking about intermittent fasting. You recall that yesterday we talked about portion control and we explored reasons why portion control does not work or does not give the desired outcome. So today we're looking at intermittent fasting to see how that can help us in our weight loss journey. So it's just another strategy for losing weight, and really it refers to periods of feeding alternating with periods of fasting. So intermittent, the clue is in the name, intermittent. So at one time you're fasting, at other times you're feeding, okay? And this usually happens within a 24-hour period. So there's a feeding window during which all your meals are taken. So you eat all your meals within a feed, what we call a feeding window, okay? And the shorter the feeding window is, the more effective this is at helping you to lose weight. So the underlying mechanism here is that you are allowing your insulin levels to fall so that the body can actually tap into its fat stores. Remember, we already fast. When you're sleeping, you're fasting. You're not eating when you're sleeping, so your body is already used to fasting. So all we're doing in intermittent fasting is that we're simply stretching the fast a bit. We're pushing it forward a bit for more effectiveness. So instead of eating your breakfast at maybe 7 a.m., you delay it a bit by a few hours or even till lunchtime. So after your dinner the previous day, your next meal is lunch the next day. You'll be quite surprised how easy this is to do. It will quickly become a habit if you persevere with it, I'm telling you. A common practice is to miss your breakfast during the week and then have breakfast during the weekend. So all through the week, no breakfast. You have your other meals, but weekend you can then have your three meals if you want. So that seems to work quite well with a lot of people. Many people already don't take breakfast. I'm telling you, through the worldwide, a lot of people do not take breakfast. So this is nothing new at all. And if you look back, think about it. Our ancestors, they woke up and went to the farm without eating breakfast. And they worked till noon before they had a meal. They coped quite well. So why can't we? Besides, remember, they were even physically more active than we are, and they would have been able to burn off any excess calories anyway. They went to the farm, they did all this physical work. We are even less physically active, so we ought to eat less. Unfortunately, people are eating more, not less, and so the persistently raised insulin levels continue to cause the rates of obesity to escalate, and with it other illnesses that come with obesity. So another way of doing the intermittent fasting is missing out both your breakfast and your lunch. So you take only dinner, for example, that's called one meal a day. So OMAD, one meal a day. So that's one way of doing it. And it's super effective for losing weight. You may decide to eat only lunch, or decide to eat only breakfast. So you just choose one meal of the day and that's all you have, okay? In that way, you've shortened your feeding window, and it's super effective in helping you lose weight. And most people tend to prefer to eat dinner, so that may be the case. You might prefer, I like to have dinner with my family, so that's fine. Then you miss out breakfast and lunch if you're doing the OMAD, one meal a day, okay? It might be difficult to start with that if you've never fasted, so you might want to just start with missing your breakfast or just pushing it further forward, by a couple of hours, see how you feel. Try the next day to push it forward by 3 hours. Keep going that way till you can drop the breakfast entirely and go on to lunch, and with time, you might want to try just one meal a day. So in all forms of intermittent fasting, the aim is to shorten your eating window. You want to shorten the time during which you're eating. So this extends your fasted state and allows your body to tap into its stores of fat. Remember to keep safe, which whatever you're doing, please keep safe while fasting. You can expect things like hunger pangs. Of course, you expect to be hungry. You can expect your head to feel a bit headachy. This can be normal, and it might just mean that you drink a bit more water. But the feelings tend to pass away quite quickly. However, if you feel really unwell, if you're having a sudden blinding headache, which is not getting better with fluids, then do stop and speak to a doctor or eat some food. It's that simple. And that's why I love fasting, because if you don't feel up to it, you can eat, then start again tomorrow. So it's very super flexible. And that's why I love it. And that's why so many people are able to do it and they're getting great results from it. So, key learnings from today. Number one, intermittent fasting often refers to periods of fasting within a 24-hour window. Okay. And the aim is to extend your number two, the aim is to extend your normal overnight fast by pushing forward your next meal. Example, missing out your breakfast and having your lunch and dinner. Okay. Number three, 1 meal a day, or OMAD as it's called, is another way of practicing intermittent fasts. You just choose the meal of the day that you have and forget about the other meals. Okay. Number four, the aim in intermittent fasting is to allow your insulin levels to fall. So that's the whole aim, and I need you to understand that. It's understanding that will help you do these things. That's why it's being taught as a series. If you understand that obesity is due to raised insulin levels, and fasting allows you to lower your insulin levels, then you get it. You'll be able to understand this and do it. So, and the aim is to allow your insulin levels to fall so that the body has a chance to burn body fat. Okay, I hope this has been useful for you. Tomorrow, we'll be looking at another way of losing weight. So please stay tuned. I encourage you to subscribe, send out this video to your friends and family. It's a free resource. We just want to educate people to look at other ways of doing things differently if what you've always done hasn't worked. If you've struggled with obesity all your adult life, I know people who have struggled with it for 20, 30 years. So why don't you consider doing something different? And if you need some hand holding, please reach out to me at fabweightlossacademy at gmail.com, and I'll try to help. Okay. Thank you so much for listening. We'll be back tomorrow to discuss some more. Don't forget to subscribe. Bye.